Farid, hi, and thank you for joining this discussion about healthcare and healthcare digitalization in Asia. Maybe for a light start, you became the general manager for Roche in Thailand and neighboring countries in 2019. So you've been there for 4 years. What are some of the reflections and observations that you have around healthcare in the country and the region?
Yeah, good afternoon, Chacha. Thank you very much for inviting me on the podcast today. So, yeah, wow, I have been nearly in Thailand for coming up to 4 years now. It's been amazing being here. So I look after Thailand, Malaysia, Cambodia, and Laos. So I have the privilege of looking after those four markets, and the healthcare system varies significantly across those different countries. But I think across Thailand and APAC specifically, we've seen a shift towards preventative care and wellness, linked with the fact that more of a focus on non-communicable diseases specifically and prevention. So I think what you see in specifically in low-income and low-middle income countries is a focus more towards disease awareness and prevention, and investments in that area of healthcare. I think we've also seen some countries specifically try to leapfrog, so to really try to think about investing in innovation to try and get ahead. So, for example, Thailand is, shifted to 5G, which is remarkable. And that is really because it wants to drive a huge digital economy. And, if you come to Thailand, and the fintech, for example, is amazing. Yeah. Even if I compare it to Europe, it's far, far superior, far more advanced than Europe, I would say. And when you think about the consumer population from a digital perspective, then it's forecast to reach around about 370 million people across APAC in 2022, and 80% of the total population would be 15-year-olds and above. So when we look at the penetration of things like mobile across Asia, it's significant. So, you see this huge drive towards providing the public with, I guess, more tools to be preventative and to screen from a population health perspective. You see a huge digital economy moving on its way as well in terms of infrastructure. And you see countries like Thailand since 2002, if you like, adopting a universal healthcare system, which is really successful and really celebrated throughout the region. But we don't get that level of universal healthcare coverage in other countries such as Philippines, Indonesia, Myanmar, Laos, Cambodia. And therefore, I think what you do see across APAC, and even within countries, which is something that I'm passionate about, is you do see huge inequalities that exist in healthcare. For example, Thailand is, and Singapore, are huge medical tourism hubs across the region. So, you get the very wealthy medical tourists who can go and get fantastic care. And then you get, obviously, the less fortunate people amongst this world who just can't even access, basic healthcare for free. And it's those health inequalities, I think, which we're kind of striving to try and address those gaps by working with governments around healthcare system shaping. But that's a reality. Yeah, if we look at, for example, Laos, and we look at the number of staff, like qualified healthcare professionals per capita, it's really, really low. Again, similar in Cambodia. And these are big issues that need addressing, of course.
So when you say that there's a visible shift towards prevention and wellness and well-being, does that mostly refer to the innovation that's happening in the area and the private sector that's kind of developing, or do you see that the government is actively investing in that? Because that's sometimes the challenge that startups face, like how will you get the reimbursement from insurance companies? And Thailand does attribute, as you said, very little to healthcare. It's just 4.2% of the GDP, according to the WHO data from 2014. I have to say that it's pretty old data.
Yeah. So you do. So I think in both. I think when we look at wellness and prevention, if you were to come to Thailand, you would be able to have a wellness vacation. And I think a lot of the big private hospitals such as Bumrungrad, Megpart, Simitivay, Bangkok General, they're investing in wellness specifically, right? And they're trying to get consumers to come and invest in themselves, in their own health. And we see a big shift there. And I think when we look at the digital startups, a lot of the digital startups, like digital health community startups, are centralized around that kind of wellness, whether that be trying to have apps that pull patients into those medical hospitals or follow up with them from an aftercare service, or trying to simplify, really targeted at a consumer that is far more affluent than arguably the general population. So we do see that. I think at a government level, on the back of COVID, I think we do see a greater investment in prevention. So, for example, Thailand last year has basically provide access to free HPV screening for its women population, which is a big shift under its universal healthcare coverage. And we're actually trying to partner now with Thai government to try and expand access. So even though it's been able to provide, let's say, free access to HPV screening, the uptake is really slow. And therefore, we're trying to work around different solutions and educational solutions using different technologies such as cell swabbing. But we also want to try and get this shifted towards a digital at-home offering. And I can talk about maybe that a little bit more later, because that's really quite exciting. So yeah, we do. I think the demand driver is there from governments, but also from the public as well, in the private hospital networks.
You like to talk about precision medicine, so I was hoping you could put that in context for us. So, how would you put it in context of Thailand? As we mentioned, 4.2% of the GDP goes to healthcare, strong medical tourism, at the same time worrying workforce numbers. If I just name a few, there's 0.9 physicians per 1,000 people. Sweden, for example, has 4.3. The US has 2.6. Nurses, 3.2 nurses per 1,000 people in 2019. That's really, really low compared to, for example, US, which has 15.7 according to the data from 2018, or Sweden that has 12.6 per 1,000 people. Obviously, these are like just two extremes, I guess, to compare. But it gives us a little bit of an impression of how the healthcare system works. So how does personalized medicine fit into this picture of Thailand?
So maybe I can talk a little bit first, before I go into precision medicine, Jasha. Maybe I can talk a little bit about the GDP spend on healthcare. So you mentioned, for example, the 2014 data, I think you said 4.2. The GDP spend on healthcare in Thailand has been flat around about 3.7% of its GDP for the last 4 or 5 years. And we've seen very, very little growth in that. In fact, Thailand ranks behind majority of countries in APAC actually on its GDP spend per capita, yet it provides a universal healthcare coverage system. So we have to sometimes be careful around the correlation between spend on healthcare and what you're able to deliver as a country. For example, you mentioned US, right? I think US spends 18% of its GDP on healthcare. That's some of the worst outcomes in maternity.
Some say even 20 or 23 by now.
And it doesn't correlate with great outcomes. They've got some of the worst maternity outcomes in the world in America. So I think the spend on healthcare doesn't necessarily correlate all the time with outcomes. Now, more money definitely helps. It definitely helps provide access to more innovation, more training, education of doctors. And you mentioned about understaffing in healthcare systems. And this is something that's really quite important, because if you think about Thailand, then arguably I think it has maybe 10,000 nurses employed within the public health system, covering a population of like 66 million people, and it's arguably not enough. But what Thailand does have, it has something called Osomor, has healthcare volunteers. So it has an infrastructure of thousands of public volunteers which look after families' health from a prevention perspective and from a health awareness perspective, and helps them navigate access, specifically in rural communities, helps them navigate access to doctors. So countries have a way of overcoming this. If we look at Laos, for example, and Cambodia, again, the number of doctors per head per population is really, really low. And then that kind of, asks the question, do we need a bigger workforce, or do we just need a different way of being able to deliver and get access to educational content? And for me, this is where digital really plays a role, in that, traditionally we would think, okay, let's train more doctors, let's train more nurses, let's provide one doctor to every few hundred patients. But when we see the emergence of telehealth, and we've seen them, if anything has been a demand driver for telehealth, then it's been COVID. Then really now you're able to get access to physicians anywhere, around a country. So geographical boundaries, traveling distances, these no longer become an issue if you harness the right technologies. And therefore the answer is can you provide greater access to services with less physicians? And I believe you possibly can. So it's around what do you really invest in? Do you invest in training more doctors, or do you invest in the infrastructure needed to get patients access to a doctor, which is really what you're trying to aim for? And if I, for example, and one of the best examples of how digital innovation can help with this is, for example, if we look at Indonesia. So in Indonesia, in the region, we have a project called Project Echo, which is a global initiative around how can you shift knowledge and not people to areas of need. And what we do in Indonesia, we provide expertise support from India and from other countries to train virtually online through case studies doctors and nurses in Indonesia, specifically focusing on oncology, and specifically also focusing breast cancer as well, because we're trying to upskill the physicians in Indonesia through the expertise we can provide digitally via Project Echo. And all that is it's just a digital mentoring platform. Yeah, it's basically what you and I are doing now, just managing case studies. So it's very simple technology, but it's about harnessing that technology and then bringing stakeholders together to try and drive an upskilling in populations. And we hope to also be doing that in Cambodia in partnership with one of the top oncology centres in France as well. So there's very simple solutions which can make a huge, huge difference to society as well. So going on to your question then around personalised medicine, Roche in 2021, we released something called the Personalised Healthcare Index, which measured the readiness of 11 countries across APAC in terms of where they were around developing and implementing personalised healthcare. And personalised healthcare range around different domains. But Thailand was ranked 7th out of 11 locations. And interestingly, Thailand had the number one policy. So it ranked number one for the best policy, but ranked 7th overall. So it links with that investment conversation we've just had, right? So if it was to increase its GDP per capita in healthcare, maybe invest in its PhD policy, Thailand would have an amazing PhD approach, personalized healthcare approach. And what we see when we think about PhD, probably the most mature area is in oncology, where you can perform comprehensive genomic profiling tests to understand what is the genomic mutation of a certain tumor type, of a certain cancer, and then being able to treat that with a targeted therapy to achieve a better outcome for the patient. And we see, really good uptake in countries like Singapore, of course, Australia, Hong Kong, Taiwan. But last year, we signed an agreement with the government to provide a knowledge transfer of how you could do CGP, comprehensive genomic profiling, locally. And we're hoping that will then provide increased access, increased capability and knowledge for Thai physicians and Thai hospitals here. And the question is once you provide access to the diagnostics, can those people get access to the therapeutics as well? So personalized healthcare across the region is definitely developing. And even countries now, when I look, such as Philippines, for example, in one of their major hospitals, are starting to use and access a lot of comprehensive genomic profiling. So this idea of personalized healthcare, specifically oncology, is happening in at least now in the lower income countries, and is pretty well established in the more affluent countries in our region.
And you mentioned quite a few projects and outlined the environment that you operate in very nicely. But I do wonder if you could explain what's the mindset or strategic thinking that Roche has in terms of digital health investments and development in this specific region. So you worked in the UK before and in Iran. You're now in Thailand. So I imagine that the approach is different in each of the environments.
Yeah, so I think Roche, as an organization, as a global organization, we recognize that digital healthcare is here to stay and to disrupt, and actually linked with our global strategy of personalized healthcare, we really see that digital is an enabler for that. Yeah, so it's not just about having, great platforms to do genomic profiling, but can we personalize the patient experience through digital technology? And I would say across Asia, Rose has some great examples. So maybe if I can share some of the examples in Thailand. So you mentioned before that the number of, for example, doctors or nurses per head per population in Thailand was quite low. And what we see is how that plays out with patients is that when we did some research in lung cancer, for example, one of the pain points for doctors and for patients was time. And when we dug a little bit deeper, doctors could provide a consultation but what they lacked was to really give some, let's say, a lot of bedside manner and a lot of educational information to the patient about their lung cancer. And patients themselves said, I just don't know where to go to get any more information about lung cancer. Yeah. And when I leave the doctor's office, I have so many questions and I don't know where to get great answers. So what we did is we partnered with the Thai Lung Study Group in Thailand, and we've developed a website called Lung and Me, and it's all in Thai. And the doctors provide videos. It's a place where patients can go and create their own communities and learn from other patients. And that won an award actually in 2022 for one of the best digital health pieces of innovation in healthcare across Asia. And that's a great example where you can provide a digital solution to a problem. We also look at in other markets. So, for example, if I was to take you to Philippines, for example, in Philippines, in breast cancer, they've developed a patient app, for women with breast cancer to help provide exactly the same things, medical education. And that app's called Gabayaka. I'm probably saying that wrong. But again, it's an issue because health literacy amongst Philippine people is a barrier to early breast cancer screening and detection. And essentially, it's co-designed with patients and physicians to provide basic education, to assist them, to remind them to attend certain appointments, such as mammography screening, and essentially provides them relevant clinical information in a personalized way and keeps the patient and the doctor up to date of what's going on with their treatment, with their screening program, etc. And so there's lots of different things that we're doing across APAC. We have a incubator called Criosphere, which is a Roche incubator across APAC. So if anybody of the podcast Googles Criosphere, they'll probably see some problems we're trying to solve, and startups can go on there and they can try to kind of solve those problems, and then we screen them for investment. So that's something that we do. But at a country level, because we know the problems we're trying to solve, with the ecosystems and with the healthcare environments we serve, we do invest, and we do make sure that we can address those challenges. On a link with personalized healthcare, for example, in ophthalmology is a new area for Roche, and we're really excited about it. In Thailand, we have a ongoing clinical trial at the moment to test a startup visual aid that comes from the UK. So this visual aid that comes from the UK can not only enhance somebody's vision that has diabetic macular edema, or enhance somebody's vision who has wet age macular degeneration. So it gives them the sight, but at the same time, what we're testing is, can we test the deterioration of sight in real time? So people are using this as a visual aid to help them see, but can we also detect when, do an ophthalmology test rather than going to the optician? Sorry, for an eyesight test. And in real time, if we're able to detect their deterioration, then hopefully what we'll be able to do is consult with that patient much sooner about, do they need a titration? Do they need a different dose of medicine? Do they need to change therapy, for example? So that's really trying to personalize the patient experience at a local level. So there are many different things that we're doing, and I think as long as it helps personalize the patient experience, and that could be or improves their outcomes from a personalized therapy perspective, or a digital therapy or a digital biomarker that we're looking for, then we're certainly interested. Digital health is here to stay.
What are your observations about the digital health market as such in Thailand? So are you monitoring what kind of startups are popping up? I find it interesting that you mentioned that basically you're testing a UK startup here. Now, obviously, startups are never built just for one country. So I'm interested in hearing from you how you see that, just companies move into Thailand or just expand out of Thailand.
Yeah, I would say that Thailand specifically has a thriving healthcare startup ecosystem, and we see a growing number of companies that are emerging to address certain challenges within, let's say, the healthcare sector. So I think we're seeing more startups, and some of those are, let's say, the size of the company might be 2 people, but then we see some really promising startups that we think have some great promise. So, for example, there's a company called Dr. Raksa, which is a big telehealth startup in Thailand, and that fits in well because under the Thailand 4.0 strategy and the e-health strategy, Thailand really wants to support them, and in fact, they've introduced tariff rates for telehealth as well, which is a really great sign from the organization. So those types of things, those types of demand drivers, when a government is going to pay for a telehealth consultation and address some of those barriers, then you know that if you've got a startup with an innovation in the telehealth or telemonitoring space, that Thailand is ripe. From a Roche perspective, sometimes we'll do things like hackathons in a country. So we'll have a problem statement and we'll invite startups to come and address that problem statement through different types of approaches. And obviously digital was just one approach of sometimes addressing a problem statement. But one of the things we sometimes see is some startups don't always have a great understanding of healthcare. They have great knowledge when it comes to tech, but they could have some great solutions to sometimes a problem that doesn't matter. So, what we're interested in is we're very good at identifying problems that matter because we work directly with doctors, we work directly with patients, and we understand the challenges in terms of access and scalability of getting a product to market. And startups obviously sometimes don't have those capabilities. So there's usually a great match when somebody's got great technology, understands healthcare, and then we can provide obviously that knowledge around how we can provide scale and access to the market. So we do incubations, we do hackathons, and that varies across market. But I would say Creosphere is probably our main hub across APAC at this moment. There's a startup that excites me in Thailand called Ever Medical. So Ever Medical's got a great proposition. They have partnered with a lot of hospitals in the northeast of Thailand, and they've got around about 2 million healthcare records, medical records, on a blockchain platform. So they're able to, for example, using that blockchain platform, provide secure access to that healthcare data for things like clinical trial recruitment, which enables better outcomes for Thai patients accessing. It provides a more rapid recruitment for companies like Roche when we want to do clinical trials in the company. But it's also a great way of being able to do things like outcomes-based contracting, where we'd like to look at, say, well, okay, a company has a great drug that has this promise of a great outcome, but we'll monitor it through the platform, and we can monitor that at a patient level, and then a payer or a government can pay us depending on the outcome. So it allows us to innovate around different pricing approaches as well. So having that data on blockchain opens up different possibilities. So I think Ever Medical are a great startup as well. And then actually in Thailand, one of the companies that sometimes often ask me to speak for them is a company called TechSource. TechSource is it does podcasts, it does events, and really aimed at many different aspects of the tech community. Health is just one vertical they focus on, but they actually have a Thailand accelerator. So they have a Thailand accelerator for startups, for promising startups, to help them, provide them with funding, provide them with investments in terms of access to people like me to help with coaching and mentoring, or to companies who want to incubate them. So I think the startup environment in Thailand is very promising, and I think the government has a clear strategy that it sees digital, then the digital economy as something that it really wants to invest in and see grow.
So the company that you mentioned, that enables easier preparation and the recruitment of patients for clinical trials, did you actually work with them on any cases? So is this something that you just like as an idea, or have you also tested it in practice too?
No, so we're actually trying to look at how we can recruit patients into clinical trials, maybe a little bit simpler, to identify the right patients. So we're exploring that with them. We have explored the ideas of doing an outcomes-based contracting model, but they don't necessarily, there are 66 million patients, and then a majority of the patients access services in Bangkok. So they don't. So one of the things that they have to do is try to get more electronic medical records from the Bangkok population, because it's a entirely different demographic. But one of the things that we're hoping to do, and linking back to HPV screening, is Roche has created a community called Mission Leapfrog. And for any of those listeners who are interested, we'd love more people to join Mission Leapfrog. But Mission Leapfrog basically is a group of concerned citizens who are trying to address some of the biggest healthcare challenges that we see in Thailand and in the Philippines. And what we're trying to do in Thailand is we're trying to address the challenges of vulnerable elderly women in urban areas, in fact. And the WHO says that Thailand's biggest challenge is actually vulnerable elderly women. And actually, why urban areas and why not rural areas? Well, earlier on in the podcast, I'd shared that there was these healthcare volunteers called Osamo that are readily available in the rural areas, but not in the urban areas. So actually, women in urban areas are far more vulnerable. So when we've looked at that challenge, we've actually started to partner with the National Cancer Institute around how could we drive more access to HPV screening. And because despite the government making this available last year, the uptake has been really slow. And what we're trying to do with the National Cancer Institute and some partners in the southern provinces is to test the uptake and the let's say the acceptance of self-swabbing. So one of the barriers we see with women is that they, often have very busy lives, don't want to go to their doctors for a HPV smear. Yeah. Whereas what we've seen a greater accessibility through some community projects of women, once educated, can just go and take a self swab of their cervix, put it in the test tube, send it off to a lab and get their results. Now, what we're hoping to do as an experiment this year is we want to create a swabbing at home service. Now, we want to target specific women of a specific age group, of a specific risk. Yeah, so we want to stratify the population of women, and then we want to target them with the education and approach to get them to order the self-swabbing, perform the self-swabbing, and therefore we really think we can go from screening, a few hundred women a week to thousands of women a week. Now, going back to Ever Medical, because they have a population of 2 million medical records and they're able to communicate directly with the patient who has that medical record, they can do this stratification of women who meet the national guidelines of women eligible for HPV screening. And therefore, what we're able to do then is target these women specifically with a specific message, to help get access for them to HPV screening. So this hopefully will be something that we can do with Ever Medical moving forward.
We for certainly see a large shift and developments with at-home testing, where basically it's not about having rapid tests that you do on your own as with COVID, but actually just taking samples that are then checked in certified laboratories. I have one more question. So Thailand is positioned as the second largest economy in Southeast Asia. It has 72 million people. So I imagine it's an attractive market also for startups that are trying to enter it from other countries. How much interest do you see from companies abroad to enter Thailand, and what do you see are either some of the misconceptions that they have about Thailand and the digital health market, and also the culture. So what does it take to actually succeed on the market, according to your current observation?
It's a great question. So actually one of my other hats, other than being the obviously GM for Roche for Thailand, is I'm also the president of the European Business Chamber. So we represent around about 130 companies across Europe and Thailand within that chamber. And we work very closely, obviously, with those companies to understand what some of their challenges are. And we often get new companies contacted us who are thinking of investing in Thailand. One of the things I would say is that the Board of Investment in Thailand is very welcoming to investment and has different incentives depending on the technologies that you want to bring. But for example, I think in 2020 they had more than 50 applications for investments in projects totaling $400 million in the first half of 2020. So you can see that companies do want to invest into Thailand. That Thailand has an educated workforce as well. So, and again, I think the digital enablement and digital maturity is very, very high. And I think, as I say, I gave the example of fintech. There's multiple apps for e-commerce. There's multiple apps to, order your lunch or your food online. Much more so than I've seen in other countries. So I think that, you've got a very digital savvy consumer. And then you have obviously companies who are providing those digital services behind. So I think, talent is there. Talent is available for companies wanting to enter. We see big companies such as Agoda have their centralized office here. And Agoda is obviously one of the biggest online platforms in the world when it comes to, booking your vacation or your flight. So I think we do see a very mature economy as well in Thailand. So I think that the market entry, I think, is competitive. Yeah, because you've got so many startups, but I think there's an equal playing field. Thailand has, again, it's a big country, 66, 67 million. So there's a lot of patients or people you can serve depending on what sector you're in. And it's one of the fastest growing medical tourism hubs in the world. So from a consumer perspective, that's is a big element to tap into as well. So yeah, I think Thailand is definitely open for business. I think the government is really behind the digital economy. It wants to become the world's foremost destination of medical tourism, in wellness, in medical services, in medical products, and in academic activities as well. And it's made that commitment. That's really, really clear as well in the meetings that I have. I think bioenergy, green energy is also another huge area of which Thailand wants to basically make sure that it becomes world renowned in. Automotive is another one, but digital is definitely up there. When I was with the Prime Minister in November, he was reiterating the investment needed and drive that he wants to make that drive a digital economy here in Thailand.
Has anything surprised you in 4 years since you've been here in terms of the culture and how you basically need to operate?
Thailand is a wonderful place to live, first and foremost, for any expat. I think people really struggle when they have to leave, or there's many people who I talk to, expats, who come here and then just stay here. So I think first and foremost, it's a really great place for families and for people to live. It is paradise. The food is great. So that's really great. Yeah. So you don't struggle to try and attract talent into the country, which is first and foremost. I think Thai culture is, again, very welcoming, and people are very kind, very helpful, very supportive. And I think that, for people that have worked in Asia, sometimes, being able to understand the cultural differences in terms of how people kind of respond, or hierarchy exists in Thailand as well. So respect is a big thing culturally as well. So for companies which maybe are startups, have younger leaders where hierarchy is not much of an issue. Again, you have to also understand the environment you're working in, and when you're working with different companies. Has there been anything surprised me? I think there's probably been lots of things, Jasha, but I think everything's been a pleasant surprise. Yeah, I thoroughly enjoy working here. As I say, I think one of the things that I love working in the region is because of the people that you get to work with. I think one of the things that surprises me is despite all of the innovation that I see in Thailand and all of the great things they do, is you still have these massive health inequalities. Yeah, you still have this low investment in healthcare. You still have, less access to innovative medicines than you see in other low middle income countries. And that for me is something that we fight for every single day to try and address.
Okay, let me just stop recording.